Good morning, Joyce. How are you?
I'm good. How are you today?
Fine. My name is Marthenia. I'm the nurse for Shawnee.
Nice to meet you.
Nice meeting you as well. Sorry for reaching over you. I'm going to grab your vitals and find out what brings you in today, okay? Are you allergic to anything?
I am not.
Are you on any medications?
Yes, I am.
Okay, I'm going to grab a list of those in a second. Do you have any paperwork you need filled out?
No.
Thank you. Your temperature was 97.1, blood pressure 130 over 68.
Thank you. Is that good?
Welcome. That is good. That's awesome. If you don't mind, I'm going to grab a seat closer to you.
Okay.
Okay. Now, what seems to be bothering you today?
Well, I know I would like to talk to the doctors about my pain.
Pain?
Mhm.
Where's the pain?
It's all over.
How long have you been experiencing pain?
Oh, it's been a while now. I've been to many doctors and no one can seem to find the problem.
Excuse me for interrupting. When you say a while, is that days, months, weeks?
For months.
Months, okay.
Mhm.
In what area of your body?
It's just all over. Just all over. When I say all over, all over.
Is it to the point where you can't get up in the morning or can't function throughout the day?
It's more work. It wakes me up in the middle of the night, and yes, I do have trouble getting out of bed at the start of the day.
Okay. I'm going to address these issues with Shawnee,
Mm-hmm.
the physician assistant that you'll be seeing today.
Okay.
I'm going to let her know that you need medication refills, and
Yes.
she'll be glad to take care of that for you. And I'll be back in later on, okay?
All righty. Thank you.
All right. It was nice talking to you.
Same here.
Thank you. Hello. How are you?
Got a new one.
Oh, sorry. Gosh. Okay, so what's going on with Joyce today?
Joyce is in pain all over her body. She says it's been going on for months.
Okay.
She's not exactly sure what it is, but she did want to address those issues with you.
Okay.
And she did need medication refills.
What medicine does she need to be
She
refilled?
wasn't quite sure.
Okay. Okay, thank you.
All right. You're welcome.
Hi, Joyce.
Hello.
How you doing?
I'm good, doctor. How are you?
You doing good?
Yes.
Okay. So, okay. So, just wanted to talk with you a bit before we start, okay? I know that you talked to Marthenia about some stuff that's going on that's of concern.
Yes.
You've been having a lot of pain,
Mm-hmm.
number one. And number two, two other things I wanted to discuss with you. Your colonoscopy results,
Okay.
and also the anemia, okay? Or you remember you were having some fatigue and stuff like that, and we thought it might be a blood issue, okay?
Yes.
All right. So what's going on today with your pain?
Oh, it seems to wake me up, out of my sleep.
Mhm.
It's all the time. It's all over. And I can't even get up in the mornings without having pain.
Okay.
And it interferes with my activities.
Okay. And how, now we started you on a pretty low dose of Lyrica.
Mm-hmm.
So has that helped you at all? Have you been taking it every day?
I have been taking it as prescribed.
Okay.
I do know the one that begins with the P that they took away from me. That works better.
Okay. So the one with the P, you mean Percocet?
Yes.
Okay. So the one with Percocet, the reason why I switched you from Percocet to Lyrica, I know you weren't super happy about it, but with current treatment guidelines, it's not recommended for chronic pain, okay? It has really nasty side effects, and we wanted to switch you to something that was going to be less nasty, okay, or going to be something that you could deal with your daily life,
Mm-hmm.
okay?
Mm-hmm.
So with the Lyrica though, however, we have you at the lowest possible dose, okay? So we wanted to start you out low and slow, as we like to call it, all right? Now, that being said, I wanted to talk with you today anyway about your pain to see where you were at, to see if we had made any headway. But I'd really like to increase your dose today and see if we can get any headway with your pain, okay?
And when you say increase, how?
So I was just gonna increase the dosage, so you're at 50 milligrams right now, so we can definitely increase that a little bit more, okay, and see how you're doing, okay? So we have initially, we have you at, oh, I'm sorry, I apologize, so we have you at 150 milligrams, you take that twice a day, correct?
Yes.
I apologize. So I'd like to increase your dose just a little bit. I think probably would like to do, at least to increase it to 300, okay? All right, and see if we can get somewhere with this,
Okay.
okay? Because I know you like gardening, right, from what I understand?
Yes,
I know
do.
you like it. You're a
I
fantastic
love it.
gardener, huh?
Yes.
All right, so we want to get you back out there,
Okay,
okay?
thank you.
So,
Thanks for asking.
all right, yeah. I like gardening too. I'm not very good at it, but maybe you can help me.
Oh, sure, once I
Okay.
get better.
Absolutely, and you will hopefully get some relief, so we can, that's the goal, so that you can go back out there and do what you like doing, okay?
Okay.
So, about your colonoscopy,
Yes.
okay, so your colonoscopy, how did the prep go?
Oh, it's not too bad.
Not too bad, so
Yeah.
it wasn't awful?
No.
Well, so you're lucky then. They actually, so when we did the colonoscopy, we wanted to do it because you were having some issues. We looked into, remember the little cards we gave you? We were actually checking your stool for blood. We had you, wipe stool on the little cards. Okay. So we found a little bit of blood on the cards, so we sent you in. Remember, I'm just recapping from the last visit, okay? Now, when we did the colonoscopy, or when the doctor did the colonoscopy, when I looked at the report, he didn't find anything that would indicate in your lower colon that you have cancer. So your colon is actually divided into two. There's the large intestine that's in the middle, and there's small intestine that's in the middle, and large intestine that's on the outside, okay? That's when they stick the camera up there and they go around and look all in your colon, make sure you don't have anything growing in there. What I mean by, remember, the primary concern was that I know you're just around the age of looking for cancer, okay, colon cancer. And so that was, any bleeding in your lower intestine is colon cancer until proven otherwise. So we wanted to check, okay? Now, that being said, they look for polyps, which are tiny little cancers, or little precancerous lesions, okay? And they're literally like, some of them are about the size of a pen tip, okay? Like this, okay?
Wow, that's
So they're
small.
super, super small. Now, they actually did not find any in your colon, okay?
Awesome.
Absolutely awesome. So they didn't find anything in there that would indicate why you would be bleeding either, okay? Which leads me to, before I jump to anemia, based on those findings, they want to bring you back in 10 years.
Wow.
Yes.
That far
So,
away, huh?
that far away.
That sounds like it must have been all excellent news.
Absolutely
Oh,
excellent down
boy.
there. You're clean as a whistle.
Oh boy.
Okay.
It's gonna be happy.
Absolutely. So, that being said though, we are going to do some more investigating as far as the cause of your anemia, okay? So I'd like to send you to the GI doctor that you saw, Dr. Brown, again, and have him actually do your upper GI tract, or your stomach, your esophagus, the tube that, you eat and food goes down into your stomach. So your esophagus, your stomach, and also your small intestine, where your food is actually absorbed and used by your body, okay?
So it actually could be a bleed up there as well?
There could be, okay? And so we're also going to do some blood work also and look and see if we can figure out a cause in your blood as to why you're still having some anemia, okay? And until we do that, your iron is a little bit low, so I'd like to start you on some iron pills, okay?
Okay.
Now, iron pills are to be taken every day, and people don't love iron pills, but because they can cause you to be constipated. So I'd like you to make sure that you're drinking plenty of water, which means, I usually ask patients to at least drink about 48 ounces a day, which is one of those, little, you can go to the store and get like a 16-ounce bottle, okay? And also give you some stool softeners, okay? Now make sure that you're getting plenty of fiber, which means, fibery cereal in the morning, something delicious like Raisin Bran, or, you know, make sure you're eating plenty of fruits and vegetables as well, okay? Alright, and also something that helps with constipation is walking,
Really?
okay? Yes, ma'am.
Oh,
Okay.
I never knew that.
Yes, you get those bowels moving, okay?
Okay.
Alright, so, that's where we're going, okay?
Alrighty.
I'm gonna give you the lab rec for the blood work, and then we're gonna take it from there and see what's going on, and I'll send your stuff to the pharmacy as well, okay?
Thank you.
Why don't you come on and have a seat up here and let's take a look at you, okay?
Alright.
Alright. Time? Oh! Darn.
But that was good.
Okay.
Yeah, just finish up and then we'll run it one more time. Sorry to talk.
No. Okay,
Is
so,
everything?
so she's doing pretty well, she's still having some fatigue. We talked about increasing her Lyrica. She's aware that we're gonna follow up with her in another 2 weeks.
Okay.
Just make sure that she has full understanding about her anemia pills, her iron pills, and that she does have to take them every day. They will cause constipation, okay?
Okay.
She has to make sure that she's drinking plenty of water and fiber and taking her stool softeners, okay?
Did you want her to go to the lab for additional blood work?
Yes, I did give her the lab rec as well.
Okay, I'll make sure I direct her to the lab.
Okay,
Okay,
thanks.
You're welcome. Hi. Hi. Oh, sorry, let me close the door. Privacy. This is your visit summary.
Mm-hmm.
This explains everything Shawnee went over with you about the colonoscopy, the anemia, the iron pills that you're gonna be taking.
Mhm.
Did she leave a lab record for you?
Yes, you did.
Did you want me to show you to the lab?
Sure.
Okay, let's go.
Okay.
After you.